Folks, we have a ton of good news about the fourth stimulus check, Social Security benefits, SSI, and SSDI. Now millions of senior citizens and Social Security recipients will be seeing a big boosted increase to their monthly benefit payments. Lawmakers are proposing a new bill that would actually help Social Security beneficiaries financially. Now, here's some big news for those of you that receive Social Security benefits. Seniors and other people who rely on Social Security benefits could next year see the biggest cost of living adjustment since 1981, with an advocacy group for older Americans forecasting an 8.6% hike. So the typical monthly Social Security check is around $1,658, which means beneficiaries could see an increase of $142 per month in early 2023, bringing the average check to about $1,800. This new forecast is from the Senior Citizens League. That projection is based on the most recent U.S. inflation numbers, including the government's release on Wednesday of Consumer Price Index data for April. Mary Johnson, the Social Security policy analyst, has said that the Social Security's cost of living adjustment is based on slightly different basket of goods and services that is also tracked by the government. That, friends, is CPIW, which is known as the Consumer Price Index for urban wage earners. An 8.6% jump in monthly Social Security checks could provide some relief to millions of seniors struggling to keep pace with surging costs for everything from gas to groceries. The 69 million Americans who collected Social Security received a 5.9% COLA increase in January. This could be the biggest bump since 1982. But inflation has climbed well above that figure in 2022, eroding many seniors' purchasing power. But the Social Security administrations will set the 2023 COLA in October based on the 3 previous months of inflation data, which means the actual rate hike could be somewhat different from the Senior Citizens League forecast. More seniors are relying on food banks and stamps as their buying power erodes, with the group surveys finding that 45% of respondents in January reported relying on these resources to secure food. That is double the rate in October. What are your thoughts on this, everybody? Tell me in the comments. A federal benefits program for blind, disabled, and elderly individuals could get a long overdue update if a proposal in Washington is approved. 2 senators from Ohio have teamed up to introduce a bill to update the Social Security, to update the supplemental security income programs, and the rules for how much money beneficiaries can have set aside. SSI was created by Congress in 1972. The Senator's bills, called the SSI Savings Penalty Elimination Act, was introduced on Thursday. SSI provides a maximum monthly benefit of $841 per individual, or around $1,261 for couples, where both individuals are eligible for the program. Some beneficiaries receive far less, and the average monthly benefit for all recipients is currently $625. Many people receiving these benefits are living under or close to the federal poverty level, which in 2022 is around $14,000. In annual income for individuals, SSI also comes with strict rules regarding income and assets for beneficiaries. Brown and Portman's bills seeks to update the asset limits, which would enable beneficiaries to have more savings in case of an emergency. That is without affecting their benefits. According to economists, the current Social Security program limits on assets like savings make it difficult for SSI beneficiaries and their families to achieve any measure of economic security. Currently, beneficiaries can have up to $20 in unearned income per month, while their first $65 in earnings is exempt from the program's rules. Beyond the threshold, SSI benefits are reduced by 50 cents for every dollar of income. Those thresholds have not been changed since 1972. Brown and Portman's bill proposal also includes changes that will lift the program's income restrictions and bring monthly benefits to 100% of the federal poverty level and index them to inflation. Folks, do you support this new stimulus bill and the new increase for Social Security benefits? Tell me in the comments down below.
Is not. We want to provide a better life for our family and our children. That's the American dream. That's what we strive for. That's what we sacrifice for. And that's what Democrats' radical policies are destroying. Today, the ex-chairman of the Federal Reserve said the U.S. economy is heading towards stagflation for the first time since the 1970s. Remember, in the 1970s, Democrats had control, at the late 70s, of the White House, of the Senate, and the House, just like they do now. The CEO of Goldman Sachs also said that the risk of falling into a recession is very, very high. Did you ever think that would happen in just 1 year of one-party rule? The last time we went through stagflation was in the 1970s, after an oil supply shock. And today, Democrats' radical policies are leading to a similar shock in the terms of energy. Since April 2021, prices have risen at least 5% every month. And this year, under one-party control, prices have risen at least 7% for 5 consecutive months. Now, what does that mean?
Tell us, why is it, in fact, that we are spending over $12,000 a year on healthcare, twice as much as our Canadian friends, the French, British, countries all over the world, while we live shorter lives, and in many cases, our healthcare outcomes are not as good? How does that happen?
Well, we talked a little bit about the tomato scenario and the fact that, in our system, nobody has an incentive to save money. If you're a provider, your incentive is to bill more because you make more. And if you're an insurer, your incentive is to grow your piece of the pie, that 20% that you get to keep, so you have no incentive to keep it down either. And they keep pushing the bill back onto the rest of us. But because we have so many payers and so many providers, 700 health insurers in our society.
How many health insurance companies?
Right around 700. There is no one of them has the power to actually rein down the prices, even if they wanted to. And on top of that, you have to have a whole bunch of crosstalk, a whole bunch of billers, whether it's on the provider side or the payer side, to be able to make these financial transactions happen. That's overhead in the system
Let
that
me
all of
ask
us
you
pay
this.
for.
Does anybody have any idea? We've talked about not having enough doctors and nurses, etc. How many people do we have in the system who do nothing else but bill us and drive us crazy that we're late on our bills? Anyone know the numbers now?
I don't know if Adam has an
Adam,
estimate.
do you know, Dr. Gaffney?
I don't have the personnel number, but I do have the overall expenditures of what we spend on administration. And that's 1/3 of every healthcare dollar in the United States to administration, double the proportion of Canada.
So we are spending hundreds of billions of dollars on folks who bill us and drive us crazy, but do not provide any health care to us.
That's right.
Dr. El-Sayed?
And so that's one piece of the deep inefficiency in our system. The other piece is that we just don't invest in the means of prevention almost at all. I told you, one of my jobs was to rebuild a health department in America's poorest city. We have fundamentally disinvested in the means of keeping people healthy over the long term, the kinds of things that save money over the long term, in large part because nobody has an incentive to do that. Our system is predicated on a financial transaction after someone gets sick. So if you think about the political economy of it, there's very little incentive to prevent it all.
In terms of cost savings, and I say this to my conservative friends because I know that they're worried about expenditures, if we lowered the cost of prescription drugs in this country to what other countries pay, anyone have any idea how much savings there would be in our system? Dr. Gaffney?